this nice evening by a lovely speech about combination of PRP and other aesthetic procedure in facial rejuvenation by Dr. Fazeela Abbasi, MD, doctorate in medicine, dermatologist graduate from King's College in London, and her practice is divided between Dubai and Islamabad. Dr. Fazeela, please let us.
Good evening, everyone. It's a pleasure and a privilege to be invited as a guest speaker and sharing my experience using ERP with other aesthetic procedures. Thank you for the wonderful introduction. I think Dr. Haddad has given you a brief overview of my educational and professional background. So when we are talking to the patient, we have to know what we are exactly talking. Is it the platelet? Is it the mesenchymal stem cells? Is it the induced pluripotential stem cells? Is it the embryonic stem cell? What exactly we are delivering to the patient? And that's possible only when you go skin deep, you see things at a cellular level, how things are working. And that's exactly what we're going to talk about today. That's a platelet. That's a wonderful cell inside our bodies, loaded with growth factors, loaded with things which help in skin rejuvenation, in soft tissue healing. I hope my voice is not echoing. Is that okay with everyone? Yeah? Okay. So, platelet-rich plasma therapy is a revolutionary treatment, making headlines, and I believe in next couple of years it's going to be on the forefront of regenerative medicine. When you talk about the stem cells, you have to talk about the platelet-rich plasma therapy, and in a short while I'll explain why. As we know, it's nothing, it's simply the autologous plasma with your platelets concentrated 3 to 5 times more than the baseline values. They contain several growth factors and cytokines that stimulate and heal the soft tissues, make more blood vessels. We all know that. That's the reason it's being used not just in cosmetic surgery, in dermatology, plastic surgery. It's being used in sports medicine, pain management, and biomedical sciences these days. And that's very interesting for me. Why? Because I'm not just a clinician, I'm also a female. I'm not really sure about men, how keen they are in staying young. But being a female, this is of great interest to me. If something is coming up, and I know it can just...
We are keen on that. We want to be young, yes.
I'm very glad to find a man who thinks like us. Right, ladies? So that's important. So this is going to be at the forefront of the regenerative medicine, and we are looking forward to it, how things are going to progress, and every day there is something new coming up. Like I was just in the conference a little while ago. I'm sure everybody else was there as well. And now there's something new coming up. It's the autologous platelet fillers. Can you imagine that you can customize your own fillers? It's not going to be the hyaluronic acid, it's not going to be the polylactic acid, polycaprolactone, it's going to be your own platelets. Just imagine that you're going to walk into a clinic and you're going to order your own customized creams, formulations, because platelets, they will be coming in a topical form. It's your own cream, using your own platelets. And while we're going to go into the details of what platelets do, you can imagine that she's the head, she's a pharmacist, and she's the one who looks into the aspects of preserving platelets outside the body. So we clinicians are very excited, and we are actually pinning our hopes on these people who are sitting in labs and who are working day and night to come up with something which is new, which is miraculous. But at the same time, being clinicians, we have to stay very ethical. I know, a couple of days back, we got a call in the clinic saying, do you add stem cells in your platelets? And the nurse came up to me and she said, Doc, do we do that? And I was thinking, if that was something that could happen in a clinic setting, just like that, in a couple of minutes in a centrifuge, everybody would be walking around with absolutely no wrinkles on their faces, with absolutely no volume deficit on their faces. This is not simple. So things are happening at a very quick and a fast pace, but then it needs some more time. And that's what exactly we are waiting for. These tiny little cells loaded with growth factors, cytokines. Those are basically the magical potions that you need when you have a wound, when you have a bad skin. Those growth factors, they get released from the platelets, which have the alpha granules, the dense granules. They release it when the platelets come in contact with subendothelial fibrin threads. The platelets get activated and they release those cytokines and the growth factors. They have fancy names. There's a list of bunch of those growth factors. Basically the magical potion, which is packed inside the platelets. So they're different. Platelet-derived growth factor, vascular endothelial growth factor, they have different names. And most of their functions, they're very much visible from their names. What do they do? Like the fibroblast growth factor. It stimulates the fibroblast. What's a fibroblast? It's a factory where the collagen is made. What's the collagen? Collagen is the basic framework of the extracellular matrix inside your bodies. So that's what we all want to have. We want to have more collagen. And these platelets, these little guys, they're loaded with the fibroblast growth factors. They have something which is called the transforming growth factor, the vascular endothelial growth factor. So when somebody like plastic surgeons, they're going to talk about the wound healing, they're going to tell us how these platelet-derived vascular endothelial growth factors, they make more blood vessels. So it's going to help in a faster healing of a wound. You get new blood vessels. You excite the fibroblasts. You make more collagen. Now, I have just put in a list what exactly is interesting for me, being an aesthetic dermatologist. I'm not going to go into the details of how it helps in the wound healing. I'm not going to go into the details of how it excites the mesenchymal stem cells. I'm just going to touch it very superficially. But basically, I'm going to just keep myself concentrating on the aesthetic side, which is limited to the skin rejuvenation. So how does it do that? It's going to come in contact. We know the function of platelets. What does it do? It causes hemostasis. That means that it's going to stop the bleeding when there is a compromise in the endothelial structure. When it's going to come in contact with the subendothelial fibrin threads, the cell membrane gets activated and it releases these growth factors or the cytokines. What do? They're going to excite, hello? Can you hear? Okay. So they increase the fibroblast proliferation. And this is scientifically proven. There are studies on it. If you want the references, I didn't put them here on the slide. It would be just too much for you to handle on one slide. So if you want the studies, you want the references, we have them with us and we can email you that. So it's going to increase the fibroblast proliferation. We do need it, right? Why? Because we need more fibroblasts. We need to recruit more collagen-forming factories for more collagen. Secondly, it causes an increase in the collagen production. There's going to be more fibroblast, there's going to be more collagen, and mostly it's the pro-collagen type 1. Number 3, the very important thing, and in fact, I have got my concerns on those screens that have the matrix metalloproteinases. What is a matrix metalloproteinase? That's the proteolytic enzyme. Where is it present? It's present in our extracellular matrix. What does it do? It helps removing the cellular debris which is being formed in the cells because of the hypoxia, the oxidative stress. There's constantly a breakdown of the collagen and elastin fibers. And these guys are the proteolytic enzymes sitting in the extracellular matrix, eating them up, clearing them away. So these are like the scavenger cells. These are like the cleaning or the dusting cells. Now with aging, there's a biological clock in every cell. With aging, what's happening is that there is accumulation of more debris. there is just more and more debris in your cell and there is less production of the good stuff. So these guys, they become weak and they get reduced in number. Just the way the hyaluronic acid or the moisture level in the skin decreases, these matrix metalloproteinases, they also become less in number. So that means you need more of these guys in order to have a healthy cellular environment. And guess what? These platelets, they do increase the expression of the metallic proteinases. So that's a brilliant thing for the skin rejuvenation, for the removal of the photo-damaged components of the skin. Then as far as the wound healing is concerned, because once we're going to discuss about my clinical experience in combining PRP with other aesthetic procedures like fractional lasers, I will show you how this helps in the early wound recovery. We talked about it. How does it do that? It helps the cell in, not exactly the bypass, but it helps the cell in crossing the G1 cycle very quickly. What's the G1 cycle? Cycle is, a cell is having a cycle. It's having its lifetime and it's going through 3 phases. There is a G1 phase, it's like a checkpoint. So the cell is going to just, take a little bit of a pause over there and assess things, how things are happening before it goes into the next stage. So that is important when we're talking about the tissue regeneration and the biomedical science, that's really important. And that's what these guys, they're doing, the platelets. They have growth factors which are going to enable the cells to cross that G1 cell phase in a very, very quick manner, and this is going to help in the early recovery of the wounds. Then, this is very important for me, and I would like to have a feedback from you guys if you know something which is actually happening clinically as well as in the labs as far as the mesenchymal stem cells are concerned. Now, according to few studies, I have come across studies where they have actually shown that first of all, what are mesenchymal stem cells? Before just going into the details of that. There are 3 kinds of cells, stem cells. The embryonic stem cells that we, especially the gynecologists and the pediatricians, they are very familiar with it. And that's the reason we have now the banks for preserving the embryonic stem cells from the umbilical cords of the children who are being born now. They have a chance to get their stem cells collected. Everybody knows about it, that's happening. And I remember a case, I don't know, in Germany or somewhere, where a thalassemia patient was being treated with his own embryonic stem cells that the parents had put in the bank for him. So that's something we all know. But we are not embryos anymore, right? So if we want to excite the stem cells inside us, what do we need to do? We need to either adopt what that Japanese doctor who won the Nobel Prize in 2006, Dr. Shinyaka, I think that's the name. If anybody's Japanese and they don't like my pronunciation, please forgive me. So he's the guy who discovered the way this cell, which is belonging to my skin, and I am pretty old, but I want to have a rejuvenated effect from my stem cells. So what, from my cells, not the stem cells. So what he did, he took the cell from an adult body and he made it travel back into time by doing different maneuvers, by using those 4 Shinyaka factors, and he came up with an embryonic cell, which is not a differentiated cell, which is an undifferentiated stem cell. And now you can ask that stem cell, you can ask that guy who's not a mature guy, who's immature, and you can ask that cell to make what you want to make. You want to make more collagen, you want to make more fat cells. So that is called the induced pluripotential stem cells, the famous iPSC cells. Now, that is happening. I remember reading a news where a blind person got the retina back because those induced pluripotential stem cells, they were used to give his retinal cells back. So that's something that is happening. But is it something which has started happening as far as making your collagen is concerned? Is it something which has started happening where people are having it as an anti-aging treatment? I have not heard about that. Because if that was happening, then I'm sure everybody would be familiar with that procedure. And I would like to have your feedback on that, by the way. Now, what we can do and what is happening these days is the third kind of the stem cell, which is the mesenchymal stem cells, which are basically the multipotent stem cells which are lying in different organs and structures of our bodies. So the famous one, as we all know, which is happening everywhere around the world, is the mesenchymal cells present in the adipocytes, in the adipose tissue. So those are the cells which have been studied in the labs, which have been studied in vitro. And again, I have my reservations on that. Because once, and by the way, why am I bringing up this topic? Because few studies have shown that platelets, when they are injected along with the mesenchymal adipocyte stem cells, the survival of those mesenchymal fat cells become better. So that's when I'm saying that I'm really interested in looking forward to the advancement in the regenerative medicine, how platelets are playing their role in exciting the mesenchymal stem cells. Now, in vitro, which is outside your body, those mesenchymal adipocyte-derived stem cells, they are making everything which they're capable of doing, because they are capable of differentiating into different cell lineages. They can make muscles, they can make bones, they can make cartilage. Do you want to have a cartilage growing on your cheek when you've got the mesenchymal stem cell derived from your adipocytes or from your fat tissue? Absolutely not. So that's what happened in few places which caught my attention, and that was last year, I think, a teratoma developed on the face of a patient. So why am I bringing all this? Because we have to stay ethical, but at the same time, we need to be very, very honest and realistic with our patients. We have to make some sense when we are talking to them what platelets can do for them. There are studies showing things, but are they happening clinically? Are they happening in our hands? That's something which is controversial. But we would like to have an interactive discussion on that. This is a list of contraindications for the use of PRP. I won't go into the details of that because that's available everywhere on the net. There are patients in which you have to see these absolute contraindications. There's a critical thrombocytopenia, that means low platelet count. You can't do PRP. Platelet dysfunction syndrome, hypofibrinogenemia, hemodynamic instability, anticoagulation therapy. There are a bunch of factors that you have to keep into mind, as well as, now this is important because back home, I'm not sure back home, but I think everywhere we women are sort of binging on the answers and the painkillers. So we are just having it for nothing. So when they come to you, you have to just make sure that they are off their answers 48 hours before having the procedure. Any corticosteroid injection at the local site 1 month before the procedure, that's also something you need to keep into mind. The systemic steroid use within 2 weeks of the procedure is a relative contraindication, but I like to ask my patients about the absolute and the relative contraindications. Now, this is a wonderful procedure, and we have gone into the cell itself, and we have seen that it is loaded with growth factors, and these growth factors, they're doing all these magical things for us. Now, they are not inside your body, right? So the plasma has been taken out, and you have put it in a centrifuge. And by the way, I'm not going to go into the details of keeping the hygienic conditions we all know. So I'm not going to go into the detail of that. I think that's just a wastage of time. So what really needs to be talked right now is that those platelets are not inside your body now. So they are traveling in something, which is the PRP tube, and then they're entering your body. So the selection of the PRP tube or that kit or that system, Sana, I can see the laugh on your face. So that's very important. I was just telling her a little while ago that I've been using PRP for probably good donkey years. I mean, it's been 10 years. When there was no name for the kit, there were just kits available having sodium citrate. And we were doing the procedure. Then we got educated. Then something new came up, and that was a tube that had something in it which is called the gel. So gel tube, and then there was a non-gel tube. So something new came up. Now, what was the anticoagulant being used? In some, it was the EDTA, you don't have to go into the names, but in some it was sodium citrate, in others it was something else. Now, I mean, there's a lot for me being a doctor. I have to shop for it, and I have to shop for the best PRP kit and tube for my patients. Why? Because I care. If I don't care, I can just go and randomly buy anything. But are you going to agree with me if it comes to you and your own skin? Would you not like to do a homework on it? Yes, you would. And I do care about myself and my patients, so I would tell you why and how to choose the best kit for your practice. Now, the important thing is that you have taken the plasma and you have put it in a tube, or you have collected in a tube. Does that really have to have a gel which is made up of silicone? Or is it better not to use a gel because there's a chance those silicone particles can enter and penetrate your skin by accident? Which one would you prefer? That's number one question, and I still have that question because I have to rely on those silicone-based thixotropic gels being used in the PRP tubes. I have to know, and I have to be damn sure that that does not let any of those silicone particles get into the skin of my patient. That's important. Now that's something that can be something that you can trust by having the right kit which has the right kind of gel. If you cannot afford to buy the quality kit for your patient, don't bother to use kits which have substandard gel. Don't do that. If you really want to go ahead and don't want to spend money on a good quality gel-based PRP kit, it's better you use the one which does not have the gel and just has a sodium citrate as an anticoagulant. That's the piece of advice I can give you. Now, this gel is going to trap, it has got small little pores inside it, and it's just going to allow platelets to travel into the plasma, but not the white blood cells and the red blood cells. Now the next question should be, why can I not have any of the white blood cells and the red blood cells in my plasma? What's going to happen? They're my red blood cells, they're my white blood cells. So what if they escape into my skin? Now, the white blood cells, they really have to stay within the tube after centrifugation. Because if they get injected in the tissue along with the platelets, it's like a stimulus for the body to think that there is inflammatory reaction going on. All the macrophages and all the inflammatory cascade is going to initiate, and the platelets that you have injected, they might get flushed in the lymphatic system. So that's the important thing that you have to remember, that no white blood cells should be in the plasma. And for that you have to make sure that the gel or the tube that's being used is actually going to trap them within the kit, and it's not going to let it float in your plasma. Red blood cells, obviously you don't want to have red blood cells, because if the red blood cells get injected in your tissue, that means that there is a hemorrhage in your skin. And I have seen side effects where you inject patients, especially in the tear trough, and they come complaining that there is a Tyndall effect. There is a bluish discoloration because you have actually put red blood cells deliberately or non-deliberately, but the kit was not right. So you need to avoid using those kits which are actually using substandard products which are not able to keep the red blood cells and white blood cells inside the tube. These are the different anticoagulants being used, centrifugation time, temperature, the pH of the PRP. That's very important, but those are the questions that you need to ask the company guy. They can explain it to you. Now, this is important. You have to activate the platelets. Now, a lot of times, the platelets, they're not activated. The moment you have it, you want to inject them. Because we have been using PRP for a couple of years, so that's how it used to be. But now you know that you have to, the half-life of the platelets outside the body is 4 to 5 hours. And during that time, by adding the calcium chloride, you're actually releasing the growth factors, you're activating the platelets. So once you inject the platelet-rich plasma, it has almost 90 to 95% of the growth factors and the cytokines. So even if you have given a little bit of a white blood cell and the inflammatory reaction has been initiated, it's fine. Because the growth factors have already been secured within the plasma and they have already gone inside your skin. Now in face applications, I would say I have combined it with each and everything, as I was having a discussion, but not the same day. Why? Because once the cells are outside the body, there's so many factors involved in keeping them viable, in keeping them alive. So if you're going to mix it with different things, you might change their morphology, you might change their integrity. So why not to be patient? Why not to just do these procedures, but with some duration? Now, I have combined it. When I say combine it, that means after, let's talk about the fillers. I have combined them with fillers, but at an interval of about a month. Now, there's one filler category that I would really like to mention because I have seen side effects. I'm not going to say the brand name. It's the polycaprolepton. So I have used it with hyaluronic acid without having any complications. Radias, which is the calcium hydroxyapatite. I have used it with polylactic acid, no problems. But when I injected my patients who have had the polycaprolepton fillers, the PCA, they ended up having inflammatory nodules within the areas that were filled with the polycaprolepton fillers. So I have had my reservations and I actually conveyed it to the company as well. So avoid using, and that's happened a couple of times by the way, so just stay away from combining PRP with polycaprolepton. Give a month, at least a month duration, and try to use it in a very, very small amount where there's already a filler, especially in the tear trough area. These are a couple of patients that you can see. By the way, also this is the tear trough area and it does amazing in this area. So when we're talking about the mesenchymal stem cells, yes, from here clinically I can see that when I inject my patients after, the fillers they were also done, but after the PRP, I can see that the medial part of the cheek as well as the tear trough area, it starts having more fat. It's like, that area has started bulking up. So it's visible that, okay, it's the skin, fibroblasts and the collagen and everything, but at the same time, it has an effect on the fat cells as well. And I think they do make sense as we have gone into the details of that. So this is all combination. And by the way, it's a wonderful procedure if you do it also on the upper eyelids. So when we're doing the tear trough, that's where the focus is. Now, there are many fillers in the market that you can use for the under eyes, but there are none when it comes to the upper eyelids. So what I have been doing, I have been using the rehydrating hyaluronic acid fillers, but trust me, the PRP done in the upper eyelids is going to give you amazing results. Obviously not in one go because you have to keep on building the collagen and you have to keep on building the fat cells, as we have seen with the previous discussion. This is also fillers with PRP, amazing results. Tear trough. Now, this is also important. You can increase the longevity of the hyaluronic acid fillers. So in lips, you feel free to combine PRP with the hyaluronic acid fillers. This is a precaution, some caveats that you have to remember. Especially in this age group where the skin is lax and thin, you never overdo with PRP because it can end up having swelling that can stay for days and weeks. So when you inject someone in this age around the eyes, you have to make sure that very small, tiny little PRP, the deposits there just lay in the skin and not too much. This is also a precaution. This lady got the fillers done in the under eyes and somebody injected PRP. Now I can imagine that there were a lot of red blood cells, or if it was not a red blood cell, probably the filler got a little too much swollen inside this area, giving it a Tyndall effect. So eventually I had to dissolve the fillers for her. Combining with botulinum toxin, I do that very often, but I try not to inject PRP in the same places where you have injected Botox or the botulinum. So just try to stay away from that, but I can combine it. Then as far as threads, there are many threads in the market. I'll be very honest, I have not combined PRP with the PDO threads, but I have combined them with the PLLA threads. I like to combine it with microneedling the same day. So you do the microneedling and then you do the PRP topically as well as you inject it deep. It gives amazing results. I like to combine it with all my fractional lasers, whether those are erbium YAG, CO2, pixel, I do it for acne marks, for the acne scars, open pores, for skin rejuvenation basically. And one very interesting thing, there is no treatment of melasma. That's my tagline for my patients. When I was talking to Dr. Tariq in the afternoon and I was telling him that in my practice, if nothing is working for the melasma patients, offer them PRP. It does work. Not always, but for some patients it does. Why? Because it's making your skin healthy. It's making your skin strong. When your skin is strong, when your skin is healthy, the melanocytes probably, they're not going to work that hard as they're doing now in these patients for making melasma. But obviously you have to look at other causes as well. I like to combine it. This is my very first patient for acne scars, probably 12 years back, and I did PRP even at that time. But that was not a very high-tech PRP kit. So combining it with threads, as I said, you can, you might not, but I would suggest don't combine it with threads. Overall conclusion, Dr. Haddad, I'm wrapping it up. It's a wonderful treatment, but you have to be very careful when you actually indulge your patients into this procedure, because the expectations should be logical. Don't mince words. Don't tell them this is a stem cell. Just be honest, because platelets themselves, they are amazing structures loaded with growth factors, doing miracles for your skin rejuvenation.